For the introduction, I would like to introduce the organization and workplace involved in the chemical health risk assessment. The workplace was selected for this assessment was Makmal Kimia Am1 that located at Faculty of Applied Science, UiTM Shah Alam. This laboratory is used for teaching, practical searching, experiments and research activity that involve with chemicals. The laboratory allows students to apply their theoretical knowledge and develop their practical skills through the chemical handling activities. Since the laboratory involved with the use of different chemicals during the daily activities, there is a possibility of exposure to chemical hazardous to health (CHTH). Therefore, this workplace was selected for the chemical hazard assessment. The work unit for this assessment, which is the chemical laboratory assistant, which is Puan Khairuniza. The lab assistant is responsible for supporting the daily operation of the laboratory. Her working hours are from 8 a.m. to 5 p.m., which is from Monday to Friday. Her main responsibility is including the preparing the chemicals and the laboratory equipment, and also assist the lecturers and the students during the practical session. She also ensures the laboratory is ready for use. Besides that, she also responsible for handling, storing, and disposing the chemicals, and also maintain the laboratory documentation and records. As her daily tasks that involve with the frequent handling and management of the chemicals, there is a potential risk of exposure to the chemical hazardous to health (CHTH). Therefore, her work activities were assessed to determine the possible chemical health risk and the effectiveness of the control measure. For the objective and scope of this assessment, we have three objectives. For the first one is to identify the health risks posed by the exposure to the chemicals that are hazardous to health at the Makmal Kimia Am1. For the second one is to evaluate the degree of exposure of the workers to the chemical hazardous to health, either being exposed to inhalation, dermal or injection. The last one is to evaluate the adequacy of the existing control measures and to recommend the appropriate control measures to prevent or reduce the risk at the Makmal Kimia Am1.
Next, I will explain the process and work unit description. Our workplace assessment was conducted at Makmal Kimia Am A609 located at UiTM Shah Alam. This laboratory is used by students and lecturers for chemistry practical classes and research activities. Many chemicals hazardous to health (CHTH) are used in this laboratory. For this workplace assessment, we focus on the lab assistant because they are responsible for preparing and handling these chemicals before the experiment. Therefore, they have a higher risk of chemical exposure if the chemicals are not handled properly. This slide shows the process flow for handling CHTH chemicals in the laboratory. There are four main steps, which are preparation of chemicals and equipment, handling and use of chemicals, conducting laboratory experiments, and finally, waste handling and housekeeping. The first step is the preparation of chemicals and equipment. Before starting the experiment, the lab assistant checks the experiment schedule and prepares all the required chemicals and laboratory equipment. They also make sure that the laboratory facilities, such as the fume hood, water supply, ventilation system, and emergency equipment are working properly to ensure a safe working environment. The second step is handling and using the chemicals. The chemicals must be stored in suitable containers and labeled correctly. Before use, the lab assistant identifies the possible hazards and follows the safety procedures. They also wear the appropriate personal protective equipment or PPE, such as gloves, safety goggles, and masks to reduce the risk of chemical exposure. Next is conducting the laboratory experiment. Students carry out the experiment under the supervision of the lecturer and lab assistant. Throughout the experiment, everyone must follow the laboratory safety rules and use the chemicals according to the correct procedures. The final step is waste handling and housekeeping. After the experiment, all chemical waste is separated and disposed of according to the laboratory procedures. The work area is clean and any chemical spills must be handled using the correct spill response procedures. This helps keep the laboratory safe and prevents chemical contamination. Overall, following these 4 steps helps ensure that chemicals are handled safely and reduce the risk of accidents and health hazards in the laboratory.
For the methodology, the first step is we did gather the information by conducting a walkthrough inspection and interview on 12 May 2026. We did collect information on chemical hazardous to health CHTH use or release, workplace layout and process flow, workers at risk, engineering controls, accident and incident recourse, exposure monitoring and medical surveillance, and also training, SOP and PPA, and also safe work procedure. For the step 2, we did divide into work unit. Lab assistant was identified as the work unit for this assessment. Workers were grouped into similar risk group based on job description, work practice, and similar chemical exposure. For the third step, we did determine the degree of hazard of chemical hazardous to health by review the safety data sheet SDS of each chemical, determine inhalation hazard using table 1, which is hazard rating for inhalation exposure, assign hazard rating HR1 until HR5 based on health effects, hazard classification, H-code, and also acute toxicity. Hazard rating were used for the overall risk assessment of each work unit. We also determined the dermal hazard using table 2, hazardous properties relevant to dermal exposure, and lastly, assess chemical for irritation, corrosion, sensitization, and also skin absorption. Next is step 4. Evaluate the exposure. Assess workers' exposure through inhalation and dermal contact by consider the duration and frequency of exposure, existing control measures, and also worker training and medical surveillance by determine the frequency duration rating FR using table 5 until 7, evaluate degree of chemical release or present using table 5 until 7, assess degree of chemical release or present using table 8 and 9, assess degree of chemical inhale using table 10, and also assign magnitude rating MR using table 12, and also calculate the exposure rating ER using table 14. For the step 5, determine level of risk. Combine hazard rating HR and exposure rating ER by calculate the risk rating RR using RR equal to HR times ER. Determine the overall risk level using table 16, which is level of risk determination, and also use the risk rating to evaluate the adequacy of existing control measure and identify the need for additional control.
Okay, now I will explain step 6, which is assessing the adequacy of existing control measures. There are 3 types of control measures, and the first one is technical controls. Technical controls are considered the most effective because they control the hazard at its source before it reaches to the workers. For examples, include eliminating hazardous chemicals, substituting them with safer chemicals, including or isolating the work process, modifying the process, installing engineering controls such as local exhaust ventilation or LEV, and lastly providing personal protective equipment or PPE. It is important to remember that PPE is the last line of defense, not the first. The best approach is always to eliminate or reduce the hazard before relying on PPE. The second type of control measure is organizational control. These controls support technical controls by ensuring that workers follow safe work practice every day. Examples include safe work procedures or SOPs, safety data sheets or SDS, chemical labeling, hazard communication and PE training, and good personal hygiene practice. Even if a workplace has good equipment, accidents can still happen if workers are not trained properly. Therefore, providing information, instruction, and regular training is very important. The third type of control measure is emergency response preparedness. Even with good safety measures, chemical accidents such as spills, leaks, or fires can still occur. Therefore, every workplace must be prepared to respond quickly. Examples include emergency procedures, spill kits, emergency eye wash stations and safety showers, fire extinguisher, first aid facilities, and emergency response team, and arrangement with nearby hospital or clinics. Having these emergency facilities help minimize injuries and prevent the incident from becoming more serious. After identifying the existing control measures, the assessor must determine whether they are adequate. There are 3 criteria. First is suitability, meaning the control must be suitable for the type of chemical and the work process. Second is use and effectiveness, meaning the control must be used correctly and effectively reduce workers' exposure. And the third is maintenance, where engineering controls and PPE must be inspected and maintained regularly to ensure they continue working properly. So a control measure is only considered effective when it is suitable, effective, and well maintained. Next, step 7 and 8. In step 7, the assessor concludes the assessment by reviewing the hazard rating HR, exposure rating ER, risk rating RR, existing control measure, and potential health effect. Based on this information, the assessor decides whether the workplace is safe or whether additional improvements are needed. Then, In step 8, appropriate action are recommended. This action may include improving engineering control, providing additional PPE, conducting exposure monitoring, implementing medical surveillance, and providing worker training or retraining. The purpose is to further reduce workers' exposure and ensure compliance with the use regulations. Finally, in Step 9 and Step 10, in Step 9, the assessor provides recommendations based on the risk level and the adequacy of existing control measures. An action priority or AP is then assigned. For example, AP1 means immediate action is required because the risk is high or the controls are inadequate. AP2 means corrective action is required but it is not as urgent as AP1. For AP3 means the existing controls are adequate but they should continue to be maintained and monitored. Finally, in Step 10, the assessor compiles all findings into a complete chemical health risk assessment or CHRA report. According to those guidelines, the report is then submitted to the employer who is responsible for reviewing the recommendations, implementing the required improvements, and ensuring a safe working environment.
Moving on to the next section, let's look at our assessment findings. For this part, we focus on 3 key ideas. First, we evaluate the adequacy of existing control measures in the laboratory. Second, we determine the resulting level of risk. And finally, we establish the action priority based on those findings. Now, let's dive into each of these points in more detail.
My name is Iman and I will discuss about the adequacy of existing control for Makmal Kimia 1. We have 3 categories of control, which is technical control, emergency response and preparedness, and organization control. For technical control, the laboratory complete with engineering control equipment such as local exhaust ventilation (LEV) and general exhaust ventilation (GEV), since there are chemical hazards to health present in the work area. The monitoring and inspection record for LEV, which is fume hood, is also available on site. For personal protective equipment (PPE), currently the management provide a baseline of suitable PPE, which include 3-ply surgical mask, nitrile glove, and safety glasses. Students are also required to bring their own lab coat for thermal protection. However, during our evaluation, we note a compliance gap, which is there is no inspection or maintenance record available for the provided PPE. Next is adequacy of emergency response and preparedness. Based on our assessment, the workplace is complete with emergency response plan and procedure with emergency kits. It includes eye wash and shower station, fire extinguisher, and spill kit available at the accessible area. The management has also conducted an ERP training for the workers. Now, we're moving on to the adequacy of organizational control. Personal hygiene are strictly followed by the workers. They are not allowed to drink, eat, or smoke in the work area. Hand wash facilities and instruction are also provided in the work area. Next, workers has received training regarding safe work procedure in laboratory. The labeling for chemicals are also available, but for warning sign, it is provided, but not comply with the use regulation 2000 standard, which stated that chemical hazard warning sign must be printed in dark red against white background. Lastly, safe work system and practice. All chemicals are stored in a cabinet without lock, so as a recommendation, we suggest to install a lock for the cabinet to prevent any misuse of the chemical. At the location of chemical storage, a chemical registered and SDS are displayed. However, some of the SDS displayed has exceed the 5 years validity and only available in English language. But according to the Class Regulation 2013, SDS should be available in national language and English language for a universal comprehension to prevent any misinterpretation.
Level of risk. There have 2 things that we need to determine. First, in inhalation and second, in demand. To determine it, we do field observation and refer to safety data sheet, which is SDS. For inhalation, we asking the laboratory's assistant the frequency and the duration of chemical use. We also observe either the physical activities. To determine the degree of chemical release and hazard rating, we refer to SDS in section 2 and section 9. Next, for demand, during field observation, we alert with the duration of chemical use, and for hazard properties, we refer to SDS. Either the chemical is irritation, corrosive, sensitization after toxicity, combined effect, or absorption, and other properties. Based on our finding, out of the 31 chemicals that were assessed, 14 were identified as posing an inhalation risk. Among these, 4 chemicals were classified as low risk with risk rating between 1 to 4, while 10 chemicals were classified as medium risk with 5 to 10 risk rating. There were no chemicals that classified as high risk in this laboratory, which is risk rating between 15 to 25. For dermal exposure, 33 out of the 31 chemicals that were assessed were identified as posing a dermal risk. Of these, 10 chemicals were classified as medium risk because they may cause skin irritation and acute toxicity. The remaining 13 chemicals were classified as high risk due to their corrosive property, which can cause severe skin and eye damage.
Moving on to the action priority for technical controls in Makmal Kimia Am. Based on our assessment of the laboratory worker work unit, we evaluated a total of 31 chemical items. Out of these, 4 items are classified as non-hazardous, leaving 27 items identified as hazardous chemicals. Currently, all 27 hazardous items fall strictly under Action Priority 3, with 0 item categorized under Action Priority 1 or Action Priority 2. The list of Action Priority 3 chemicals includes common laboratory reagents such as acetone, hydrochloric acid, magic compound, and sulfuric acid as shown on the slide. Because of substances are classified under Action Priority 3, it indicates that immediate emergency intervention is not required, but standard risk management continues to apply. Now, let's look at the overall risk profile and control adequacy for laboratory worker work unit. First, overall level of risk for inhalation exposure is rated as moderate. However, the risk for dermal contact is rated as high, which demands careful attention to personal protective equipment and handling procedures. Regarding the overall adequacy of existing control, our assessment confirms that current measures are adequate to manage this risk. Consequently, the overall action priority for this entire work unit is formally concluded as Action Priority 3.
We'll be discussing about recommendation for action to be taken by the person in charge in the laboratory. So the first one is the technical control measures, which is divided into 3 main parts. The first one is to conduct inspection on the engineering control, which is the fume hoods. Because during the assessment, the inspection due date is on 5th June 2026. So I'm sure that the inspection has been done by now. So the next inspection would be around 5th June 2027. Because under Regulation 17 of IHS 2000, LEV system must be inspected at least every 12 months. Second, lab staff and students must practice handling chemical within the fume hood. This is vital to prevent airborne contaminants from being inhaled or exposed, which can cause acute respiratory irritation, especially for hazardous fumes from reagent like concentrated mineral acids or organic solvents. Third, the lab staff have practiced excellent use of PPE in the workplace, such as using safety goggles, gloves, and lab coats. Therefore, maintaining these habits might protect workers from direct chemical burns or dermal absorption. Next is the organizational control measure, which is divided into 5 parts. First is to implement PPE management program. The main objective of this program is for a comprehensive long-term tracking of PPE, which means to ensure that the PPE provided is functional and appropriate for the hazard over time. Upgrading warning signage from the current one, which uses black text on white background, to red text on white background as required in Regulation 29 of IHS 2000. Moreover, the sign should be bilingual, which is in Malay and English, so that the hazards can instantly be understood by everyone before entering the facility. Next, the person in charge must keep an updated SDS and chemical register in the workplace, because we have received an expired SDS and incomplete chemical register during the assessment. Chemical register must be immediately updated when a new chemical is brought in or change of suppliers, and an up-to-date SDS helps during emergency like chemical spills or any exposure occur. Last but not least, the laboratory has a strict prohibition for eating, drinking and smoking. Fortunately,
all the staff and students comply with the established rules, so they just have to maintain the current practice.
For emergency preparedness, the workplace already has an emergency response plan, but it should be reviewed regularly to ensure it remains effective. Emergency drills should also be conducted to improve workers' preparedness for chemical spills, fire, and also accidental exposure. Fire extinguisher and other emergency equipment are available, and routine inspection and maintenance should continue to ensure they are always ready for use. Additional CO2 and foam extinguisher may also be considered for different type of fire hazard. Emergency eye wash and shower facilities are accessible, and regular inspection should be carried out to confirm they are functioning properly. First aid facilities should also be checked regularly to ensure supplies are complete and not expired. For exposure monitoring, a chemical exposure monitoring program is recommended to monitor workers' exposure to hazardous chemical. The local exhaust ventilation system should be maintained and assessed periodically to ensure effective removal of airborne contaminants. Finally, a medical surveillance program should be implemented with periodic health assessment conducted by an occupational health doctor to detect any early health effect related to chemical exposure.